afternoon, everyone. Tonight we are deep diving resource allocation at Syntex Laboratories. It's presented by the wider team here. So before diving into the resource allocation, we really have to understand what market Syntex actually operates in. They operate in the US human pharmaceutical sales. They have 7 major products, which naproxen is the largest and most successful. Naproxen is an anti-inflammatory, and that has seen quite a significant amount of steady increasing sales and new prescriptions and total prescriptions. And as you see our increase, you can see our competitors decreasing. So again, that's a pretty big market for us. Next, we move into Anaprox, which is an analgesic, and it supports different type of pain. This market is increasing in new prescription and total prescriptions, but Syntex is a pretty small competitor in this market, and it's highly, highly competitive. Next, we move on to Lidex and Silenar, which is a topical steroid market, or topical steroid. It's been seeing a pretty steady increase, but the patent has unfortunately expired for Syntex. So as that patent expired, competition has grown immensely in that area, especially due to the fact that our competitors are selling to both dermatologists and general practitioners. Next, we move to Norelin, which is an oral contraceptive. Again, this market is highly competitive, but there is a pretty significant opportunity at the lower dose, which Syntex operates. So that's great for us. And lastly is Nisailide, which is a nasal spray, and that's a new market that we're going into. So saying all that, that's the current markets. There is future opportunities in therapeutics, but overall that's where it's at. And, we can see pretty good financials, but there's always room for improved sales.
Next, we'll begin into the Syntex laboratory sales force and the roles. So the role of the Syntex sales force is multifaceted. At the core, sales reps need to visit physicians, provide samples of the relevant products, and provide any additional information to the physicians. The sales reps have difficulty scheduling physicians' times, especially. You can imagine that between visiting the patients, surgery, writing prescriptions, training, and computing sales reps, that the physicians have little time. They have even less time for sales reps who don't trust and believe they're credible. In addition, it is very difficult to have relevant KPIs to match how spending time is actually impactful to the financials. Additionally, the sales reps are given the responsibility to define which type of physician and the visit schedule. The Syntex marketing team has not historically dictated those choices, since they believe that the individual sales reps can manage this on their own. The analysis helps answer this, that this is true or not.
When we run the relocation analysis to determine, based off using the current 433 reps that we have today without adding additional sales force, you can see that they need to be reallocated to be optimizing their effort. If we leave it in the base scenario table that you can see, we're not effectively calling on the right products with our specialties to get the most margin that we need. So if we truly optimize the effort, we need to focus our 433 reps across naproxen at 226, 96 for Anaprox, 46 for Norenal 135, 29 for Norenal 150, 37 for Lidex, and none for Sinelar and Nasalide. And by doing this, we're able to see an improved margin from $222,000 to $280,000, which is great when we think about our potential to have to hopefully hire more sales force. Having that improved margin is going to make us better. So instead of leaving it at our base and doing what was previously done, we really need to make sure that we're looking at that optimized effort and calling on the products that are going to be the most sales for us given our current workforce today.
If Syntex Labs are to keep the 433 sales force that we currently have, they should allocate these sales reps to the specialties as shown in the comparison effort of constrained optimization. This would mean that there'd be 124 to general practice, 112 to family practice, 75 to internal medicine, 29 to orthopedic surgeon, 61 to OB-GYN, and 24 to dermatologists, 8 to ENT specialists, and none to rheumatologists or allergists. The reason for this targeted approach is that if you look at these specialties, it allows for the best optimized margin. Santex is focusing over half of their sales force to primary care audiences, for example, like family and the general. And as you can see in the chart, when Santex puts an optimized focus on specific specialties with the sales force, they are increasing their margin from 221,107 to 226,886, even though they lose margin with many of their specialties, they more than make up for it with general practice and family practice. I would say that they can improve their margin by 2.4% without hiring any additional sales force, which is the goal for any company. And Santex would want to use optimized sales force numbers and not base off scenario. If they keep at 4-3, they must concentrate all of their efforts on the specialties that make the most for Santex, I would say.
Now we have an important question to answer about what Syntex should do about its sales force size and allocation for the next year. We have 3 recommendations. First, even though the opening paragraph of the case indicated that the study revealed an optimal sales force of 700, that is absolutely not borne out by the data. Exhibit 9 very clearly demonstrated that a reduction and a reallocation in the current sales force is a much more efficient method of increasing our net profit. Under the current policy with 433 reps and 97 of them deployed to sell naproxen, the net profit is projected at 218 million. But if we reduce the total sales force to 370, that's 60 fewer reps, and reallocate all of the Anaprox, Sinelar, and Nasalide reps to focus on naproxen, that's 246 total reps on naproxen, then the net profit will actually increase by over $45 million. Our second recommendation is that it's wise to deploy staff based on the product strategy rather than by the physician specialty. First, naproxen is clearly the most lucrative product in Syntex portfolio. There's no clear physician type that even comes close to driving profits to the same degree that naproxen does. Additionally, Syntex executives were fearful that diverting resources to other products would cannibalize naproxen's earnings, and we know that this did occur. So to mitigate lost market share from that temporary cannibalization, it's wise to refocus on that product allocation strategy. And our third recommendation is thinking about, in comparison to competitors, Syntex brand equity seems insufficient. And part of this is because Syntex sales force is much smaller than better known brands like Merck and Pfizer and Wyeth. But we don't know from this case study how we might improve positioning for naproxen, for example, in comparison to Motrin. Syntex should devise an ongoing quarterly marketing study rather than the sporadic engagement of an outside consultant to monitor and improve product positions. These positioning adjustments could require minor adjustments to sales force size and allocation in the next year.
Next question we should ask is, what should Syntex do about its sales force size and allocation for 3 years from now? When we think about longer-term planning for Syntex, 4 areas of strategic focus come to mind. Number 1, the current sales force allocation strategy is focused on the ROI for marketing. It does not yet take into account organizational level goals or budgeting. Just because there is an advantage to the particular mix of sales, staff, among products or physician types does not mean the company budget is enabled to prioritize those decisions. Budgets reflect priorities, and a 3-year sales force plan must be connected to enterprise resource strategy. Number 2, we know from the product life cycle to expect various periods of sunsetting and repositioning. This seems particularly salient in Syntech's market, where the next pharmaceutical breakthrough could easily siphon off sales of any one of the company's products. The sales force of the future will need to adjust in both size and allocation to compete against emerging competitive offerings and to socialize new offerings. Number 3, in 1985, sale visits were conducted exclusively in person. With the power of 2021 foresight, it is reasonable to believe that Syntech's sales force size and allocation could become more efficient with the advancement in technology. Our contemporary workforce is well accustomed to forging remote connections. In fact, physicians now regularly conduct telehealth visits with their own patients. And the number of visits per day if the number of visits per day is increased because of the reduction in travel time, the size of the sales force could be dramatically reduced. And number 4, although our recommended short-term strategy is to focus on product allocation, there may be improvements to sales force efficiencies if physician specialties are nested. ENTs and allergists, for example, are likely to prescribe similar medications. They could be combined and managed by key account managers who are knowledgeable of physician specialty needs and this aligned offering provided by Syntech.
Next, we'll discuss some benefits of the resource allocation model as it pertains to this case. First, the model was able to generate comparative solutions for the sales force allocation problem at Syntex. We were able to compare the charts at the base level using existing Salesforce effort to the optimal level of Salesforce effort generated by the model. Another benefit is the ability to manipulate the model constraints to explore allocation options at different Salesforce levels. For example, we set a constraint to match the number of sales reps at 2 of Syntex's competitors to see if the model would generate an optimal number that was as large as these 2 other companies. The model still generated optimal results with sales reps in the lower 700s. The constraints ultimately allow Syntex to build models that show realistic results. The next benefit of this model is that it can direct management's attention to areas for improvement. In this case, the optimal sales force level effort was nearly twice as large as Syntex's existing sales force. And finally, the model can aid management, decision-making, and strategic planning using realistic constraints. In this case, the model reallocated more reps to certain product lines. Using this information, management can decide if the results are something the company would want to begin to implement using its already available resources.
While there are many benefits to using this model, users should be aware that some limitations exist. The first limitation of this model is that the input data is static and based on prior periods and estimations. The model does not automatically update when new data is available. Another limitation is that the sales response for both product line and physician specialty is based on management estimations. These estimations leave room for error as they are predicting unknown outcomes. An example from this case is the model's inability to capture the actual responsiveness of physicians to Syntex's sales force. The optimal sales force levels generated by the model are based on estimations, and it is difficult to accurately estimate how receptive physicians will be to Syntex's marketing strategies. The next limitation is the model's inability to capture unplanned future obstacles. The model cannot predict events that would majorly impact the pharmaceutical industry, such as drug recalls or the invention of revolutionary substitute products. These events could affect Syntex's overall enterprise architecture, which would result in the need for new marketing strategies. Finally, the model does not generate a timeline on how to implement the optimal results with Syntex's available resources. However, through management's interpretation of the results, they can develop realistic strategies to achieve optimization using the company's available resources. This concludes the analysis of our resource allocation at Syntex Laboratories.